Thank you so much for joining us with C4 Green Drinks, and I'm excited to be presenting on a topic that's near and dear to me, which is climate change and incorporating health impacts, because as a physician, that's what I do. I deal with health and disease, mostly trying to deal with health. And I see this as a talk that where we talk about the threats that climate change and health impacts pose to us, but also really I want to focus on opportunities and make it not all doom and gloomy like many talks on climate change can make us feel overwhelmed and saddened. So, okay, so as we know, our planet is in crisis. And we face essentially a triple crisis, multiple crises, actually. What we're here to talk about really is the climate crisis that is upon us. But we also have to take into account the interlaying factors of biodiversity loss and the pollution and waste crisis. They're all inextricably linked. We just cannot separate one from the other. And here we are in this current situation. And on top of everything else, what happened to us in the year of 2020? We had a global pandemic caused by the coronavirus. And there's actually a term for these multiple epidemic level crises, which is called a syndemic. It's when they're occurring concurrently. So we have a syndemic of multiple crises affecting us. And as I said, it's a gigantic threat to humanity, but it's also an opportunity for us to change a narrative and shift paradigms. So a little Climate 101, I think many people probably are familiar with some of this, but I just will quickly talk about the greenhouse effect. And what is the greenhouse effect? Well, it's that trapping the layer of CO2, that's carbon dioxide and other gases in the atmosphere. And it's what we need to keep our Earth toasty warm, and so that we can inhabit it comfortably. So we want some of these greenhouse gases, but what is happening is that it's not just CO2, by the way, carbon dioxide, by the way, there are multiple other gases, but carbon dioxide tends to be the proxy for when we talk about the greenhouse gas effect of climate change. But there are multiple other gases, as you can see. And what is happening is that we are adding way too much more of these gases. And so we are increasing this layer of gases that are trapped, and therefore the Earth is heating up. And that is the problem of global warming. And where are these greenhouse gases coming from? Well, in this illustration, we can see that the majority is coming from how we generate our power, from electricity and heat. A huge chunk, about almost under a quarter, is coming from our use of agriculture and land use, and actually maybe it's misuse of land and bad agricultural practices. Industry plays a huge part, as does transportation. I found what was interesting was that 6.7% of greenhouse gas emissions comes from food waste. I find that just staggering, the fact that we have so much food waste, and yet there are people that are starving, and that there are people that are food insecure, but 6.7% of food that we're throwing away is contributing to greenhouse gases. So, and all of this is from most of this is coming from the burning of coal, oil, gas, and as I said, misuse of land, the deforestation that is occurring. And all of this has led to this rapid increase in atmospheric carbon dioxide levels. And there's this quick little infogram about parts per million of carbon dioxide levels from the early 1900s to present. And you can see this on this graph right here. And this is coming from the Mauna Loa Observatory, where they've been tracking CO2 levels. And we can see this from 1960s, the graph just going up, 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 and then suddenly there is this steep increase in the gradient. And if we take a look at this graph, what we're seeing here is how the carbon dioxide levels track with the surface temperatures that were measured. And they track almost to a T. So there we're seeing the correlation of the rise of carbon dioxide levels and the increase in Earth's surface temperature. And so what we're seeing is every year, record years. This is the hottest year on record, hottest year on record. And actually 2020 tied as the hottest year on record with 2016, as we can see from this pictogram. And we're at that 1.2 degrees centigrade tipping point that we don't want to exceed. The IPCC is saying that we absolutely don't want to get to 1.5. That's where we're trying to keep, that's where we're trying to stop the rise of global temperatures to. And we certainly don't want to get to that 2 degree centigrade rise. That would be catastrophic for this planet and for its inhabitants. So when we're looking at what the effect of climate change is in the United States, looking at this map and looking at it regionally, we can see where on the West Coast, and we're all familiar with all the wildfires that were occurring in 2019 and the heat waves that are occurring in the Southwest. On the East Coast, they've been plagued with just more and more and more and more frequent and more intense hurricanes. And here in the middle of the country where we are, what we're seeing is we're seeing extreme precipitation and the effects of lots of flooding, as well as rising temperatures. So where we are in Illinois, somewhere around here, this would be the impact of climate change in our neck of the woods. So this is from the CDC, and I really like this. I really like this infographic here. So this is showing you that the rising temperatures, which is leading to the melting of all the glaciers and the polar ice caps, is leading to rising sea levels. And obviously all of this is being driven by increasing CO2 levels, and we're seeing the rising sea levels. So it's all interconnected. And then we're seeing the effects in terms of severe weather, air pollution, changes in vector ecology, increasing allergens, food and water quality impacts, environmental degradation, and extreme heat. So these are all of the impacts that we're seeing from climate change. And then if we look outward, then we see what the actual health impacts are on humans. And that's what I'll be talking about. And what I like about this is the way this wheel is spinning. It's because there is nothing that is just linear. There is no linear relationship to it. It's a circular and interconnected related issues. It's very hard to tease one apart from the other and make it a one-to-one correlation. So,
Japhia, the circular movement reminded me of like a positive reinforcement mechanism, right? Or like a positive feedback loop, whereas the warmer it gets, the warmer it becomes, right? Like,
exactly.
And like these effects are just cumulative and they keep going.
Exactly, except it's not a good positive feedback.
Well, right. I guess I don't mean it that way. You know, I just like a reinforcement
right.
of itself.
Right. So it's actually all just compounding. It's a compounding effect, and it just keeps piling one on top of the other. So let's talk a little bit more about some of the specificities. So let's start with extreme heat. And that really turns out to be the leading cause of environmental deaths in the US. Who typically is at risk? Well, it's usually the elderly, babies, the infants under a year old, high school athletes, and actually other athletes, but particularly high school athletes and outdoor workers. They're the ones that are outdoors, right? The high school athletes working out hard and outdoor workers. And what are the health impacts that we see? Well, they can range from all the way from some mild dehydration to sunstroke to heat stroke and even death. And on top of that, there's a lot of worsening of chronic illnesses. There's a lot of data that is showing that the effect of extreme heat on people actually leads to increased cardiovascular disease, to increase lung disease. So again, it's that compounding effect. And people are more prone to heart attacks. People are more prone to asthma attacks, all because of being exposed to extreme heat. So again, it's not necessarily that all these deaths are going to be because everybody keels over from a heat stroke, but it can certainly worsen people with worsen illnesses in people with chronic illness, such as, like I said, people with heart disease, people with lung disease. And here's some data on annual temperatures for Illinois. And as we can see, it's trending, the overall trend is trending up. It kind of bounced around down here, and now we see where it's starting to take off here. And that just keeps with the national trend that we're seeing in rising temperatures. And here's some interesting data on extreme heat in Illinois. So more than 310,000 people are going to be vulnerable to extreme heat. Many of them are people that that live in cities like Chicago. And there is a particular type, they're particularly affected by what we call the urban heat island effect, because their built environment in the city is so much more trapping of heat than, say, where we are in Champaign, or somebody that's further out in Kelowna or somewhere in our farmlands. But that's not to say that the people in the rural areas are not going to suffer effects of rising heat. And if we're looking at the effect of heat, we're going to see that by 2050, the total number of heat wave days in Illinois is going to explode to more than 60 days in a year. And that we can see right here, over about 60 right here. Summer in the city, this is urban versus rural. Again, we're looking at Chicago really suffering with warmer nights in particular, and overall warm on average days. Here's something to think about. By the end of this century, the Chicago, Illinois will look like current day Mesquite, Texas. It's kind of scary to think what Mesquite, Texas will look like at the end of this century. And here's another interesting fact that I did not know, that Peoria is the 22nd fastest warming city in the US. Why that is, I do not know. Something that I need to look into, but I thought I would just share that interesting fact with you. And moving on to air pollution. So air pollution is another huge cause of mortality and morbidity, and worldwide accounts for about 4.2 million deaths, according to the Lancet. Now, when we look at air pollution, what we're looking at is the effect of particulate matter and ozone. Now, particulate matter can vary by size. And, it can be things that you can see, like if there is a fire, and from the wildfires, there's the obvious soot that you can see, and they're large particle size. I won't get into the particle size, but the particle size do matter, actually. And actually, if you think about particulate matter, there are these sandstorms, the Sahara dust that it's a natural phenomenon that blows across from Africa to all the way across the Atlantic to this side of the world, that's particulate matter that can certainly affect, cause air pollution problems. And it does cause a lot of problems. But it's the really ultrafine particulate matter that can really impact on the human respiratory system. And then there is ozone, which is, we can't really, it's a ground level ozone, not to be confused with stratospheric ozone, which we need and which we worked hard to protect back in the 70s. And we've done actually a pretty good job of doing that. But ground level ozone is what we don't want to be forming. And we're forming more of that. And that's formed when nitrous oxides react with volatile organic compounds. And that will be again compounded by increasing heat and sunlight. And all of these ground level ozone and particulate matter affect our respiratory system and have health impacts on us. And as you know, the source of all of this really is from the burning of fossil fuels, from factories, from our homes, from electric utilities, from tailpipe exhaust, and from industry. So what are the health impacts of these particulate matter and of the ozone? Well, if we look at this, they can certainly impact kids and adults. With kids, it can cause developmental harm. With adults, it may cause reproductive harm. If we're looking at the effects on the respiratory system in particular, it can certainly result in more symptoms of coughing and wheezing and shortness of breath, certainly increase the amount of and severity of asthma attacks. And long term, and again, it can lead to the continued damage, constant exposure and continued exposure can lead to lung tissue redness and swelling, which again, over time, could lead to lung cancer and all other types of chronic lung disease. Again, this is one of those instances where over long term, it can interact with the cardiovascular system and cause cardiovascular damage and cause you to be more susceptible to infections. And with kids, I mean, certainly you would see much more asthma attacks, much more, and it can also affect their brain development. So there's a lot of harm that can come from air pollution. And actually there was a really interesting article about talking about air pollution and the effect on kids and their ability to do test taking. And the same goes for heat. There's a lot of data, I'm just switching back to heat. There's a lot of data looking at the effect of extreme heat and sleep, which is very important to the human body, as well as the effect of heat and air pollution on test taking. Kids taking doing these standardized tests, and you know that it worsens their scores. So it has real impacts for our kids and their intellectual development. So moving along the respiratory line, let's look at increasing the impact of increasing allergens. So we know that with more carbon dioxide, plants are going to produce more pollen. And here again, we're seeing this, this rise in the amount of pollen calculated in parts per million. And look at where we're headed to if we don't do something about it. We're way up here by the year 2060. We're already up here, 370 parts per million in the year 2000. Why is this happening? Well, I mean, climate change is affecting when the delayed first frost. We're having a much earlier spring thaw, and we're having a delayed first frost, right? So we have a much warmer growing season and longer and warmer growing season, and it's more intense as well. Well, it manifests as allergic rhinitis, which affects about 35 million people in the US, many of them adults, but a huge proportion of them children. And what do you get? You get a lot of sniffling, sneezing, coughing, kind of very irritating symptoms, but they can be really They can really impact people. I see a lot of this in the clinic where I'm at McKinley. I deal with a young population of our students at the university, and it's interesting. So many of them, I see a lot of students coming in and having these upper respiratory symptoms. And many of them say, but I have allergies when I ask about it, but it's usually down in September, or it's usually at another time, and they don't, or they usually have it at this time, but it's much more severe. So I am actually seeing this impact of allergens in my practice. And so, it's always an opportunity for me to have a conversation with my students who are, very receptive to this and learning about the fact that there's more pollen because of climate change. And, it's just a connection that I don't think that they would have made. And certainly it worsens asthma. It's not just upper respiratory, but it's lower respiratory. Their asthma symptoms can worsen. So I do see a lot of that. So the other impact is it changes in vector ecology. So I'm going to focus on the vector ecology in Illinois. Pretty much it's two vectors that we're talking about. We're talking about ticks and we're talking about mosquitoes. When we're talking about mosquitoes, really it's West Nile virus that we would be concerned, increasing range of West Nile virus that we would be concerned about in the state of Illinois. Just to take a little tangent, certainly in many other countries and in other parts of the US, they are seeing their ranges of mosquito-borne diseases would be more like chikungunya and dengue. Certainly they're seeing a lot of more dengue, and malaria is another, not so much malaria in the US, but in other countries, malaria is of a huge concern. And dengue, chikungunya, no, that's chickpea, never mind. So moving along to tick-borne diseases. This is what we would be worried about here in the Midwest. Lyme disease, ehrlichiosis, Rocky Mountain spotted fever. These are things that we typically, especially Rocky Mountain spotted fever, we don't typically see here in the Midwest, but we're starting to see more of it. This is something that ER physicians probably need to be more aware of. Certainly Lyme disease, which was not a huge problem, is becoming a huge problem, and you will see why in a second.
Hey, Japhia, we have a question from the chat. Can you explain better, what does the term vector ecology mean?
Oh, sure. I'll go back. So it's just, so the vectors are, So the vectors are the insects, right? So it's ticks and mosquitoes that I'm talking about here. And they are the transmitter of, the mosquito is a transmitter of the West Nile virus, right? So they have the virus in them and they bite us and they infect us with it. And the ecology is that whole cycle of the virus within the vector, which is the mosquito or the tick, and the transmission to us. That's the whole ecology of it. And part of the ecology is their life cycle, the transmission cycle, and their range, right? I mean, prior to the temperatures warming so much, it was too cold for mosquitoes to hang out past summer here. But as our seasons have gotten warmer, right, they're able to hang around, reproduce, breed, their life cycle. They can have more life cycles, and that is part of the problem. That's something that they're certainly seeing in the tropics, and they're seeing it in warmer climes, particularly with mosquitoes. So that's what we're talking about with vector ecology. Does that answer that person's question?
I think so. I mean, that certainly helps to clarify things for me too. I mean, that was a really good explanation, I think.
Okay, if anybody has questions, you can ask me. If that wasn't clear enough, just ask me later. And so again, speaking of vector ecology, let's look at the range, right? So if we look at this map of the US, all this concentration, typically this is with the with respect to the tick, right, that transmits Lyme disease. So, you know, Lyme disease was one of those things that was always kind of in the Northeast, right? Connecticut and these places where people were always on the lookout for Lyme, right? Nobody was really paying attention to Lyme too much here in the Midwest, right? But look at what is happening on the Northeast. It's just exploded. And look what's happening here, right? This is us, right? And it's just getting worse and worse and worse. And so we're seeing more and more and more of it. And so this is what we mean by changes in their range, right? The further the more prevalent they are, then the more like we are at risk of being affected by this tick and getting Lyme disease. So I'm going to move along to water quality. And
actually, Japhia, can you move back to the previous slide?
Sure.
Someone would like to know, do you know why there is a gap in Michigan? Is it possibly a lack of detection efforts? So like just not being reported?
No, why would they? I don't know.
Is it because it's still remaining pretty cold up there because of perhaps like some lake effect?
I was just thinking about lake effects up in Michigan, because I mean, certainly it's exploded in Wisconsin, right? The biggest concentration there is in Wisconsin. I think with Michigan, it may have something to do, you know, their particular microclimate there with the Great Lakes in particular that is prohibiting the reproductive cycle. A lot of it has to do with the reproductive cycle of you know, of the organism within the vector. Like it's very complicated. I did a whole lesson and I still am confused about what people think about malaria and the whole, you know, that organism, and they just don't know. I think it's this ongoing study and they're confused enough about malaria, which they've been studying for decades. So I don't know that they have a necessarily good answer for why there's this gap in Michigan. But if my best guess, most educated answer would be it has something to do with the particular microclimate or macroclimate there that affects the organisms and the tick's life cycle.
Andy, did you want to say something? Would you like to add to the conversation?
No, I think it's just, there was a question in Illinois even. I had a friend that had Lyme disease in 1998 and contracted it very badly in Illinois. So it's just interesting to see even in 1997 how few cases, unless that case is in Peoria or Champaign, but you know, the detection, whether it's an unknown disease or detected as Lyme, and we lived in Lyme, Connecticut for a couple of years too. So it's certainly, every time I would get a tick bite out there, the doctors would immediately treat you for Lyme disease. They just say, yep, everyone just gets penicillin or whatever it is that you get.
Doxy, yeah. Yeah, and that's just because they're so attuned to it in the Northeast, right? They're always on the lookout for it. So, you know, it's sort of default. You were out hiking and you feel this way, here, take some doxycycline. Whereas, you know, maybe 20, 30 years ago, people are like, what? You went hiking and you feel ill? Oh, you're probably, you know, and they're not thinking of Lyme. Whereas now we have to it's definitely in our repertoire of our differential diagnosis. And that's what's different. So in moving along to water quality impacts, again, I love these fun, colorful infographics. We're obviously seeing increased precipitation, and that's the big thing that we're seeing in the Midwest, right, with climate change, is heavy downpours. And what does that do? It overwhelms or storm drains or stormwater systems or septic systems. It floods our farmlands and it floods our homes or businesses. And all of this ends up, you know, can end up flowing into our streams or rivers, and it can and this is, you know, agricultural waste, chemicals, raw sewage, you name it, and can contaminate our groundwater or drinking water. On top of that, certainly can contain bacteria, viruses, and parasites, which can lead to waterborne illnesses. So here's this little infographic about giving some data on precipitation in Illinois. I thought this was a little interesting in that I did not realize that way back in the 1840s and that era that we actually got it was quite rainy. It was quite rainy back then. And then we started to trend down. Here we are trending up again. So that was kind of interesting for me to learn. But what we're seeing here is the extreme precipitation events are definitely increasing, and that's what these dark green blocks are in this. So what we're seeing is these 100-year floods are no longer 100-year floods, right? Or these 500-year floods, these extreme precipitation events are no longer this every 100 or every 500 years. They're happening very frequently now, and that is what is problematic for us here in the state of Illinois. And it can obviously, as I said, contaminate our drinking water, but there's another impact of what that affects water quality, and that's what we call harmful algal blooms. And I think we've walked around neighborhoods and we've seen these ponds with this, icky green scum, the algae floating on the ponds. And obviously none of us are trying to jump into that and take a quick swim, or we don't want our dogs jumping into that. And that's for a reason, right? Because they can really, they can cause a lot of health problems. And again, with all of these big precipitation events that we have, these extreme precipitation events, we're seeing where a lot of the documented waterborne disease outbreaks occur right after we have these extreme precipitation events. And what are these typical kind of diseases that we see? Well, we see some cholera. And that would, probably be more in a developing country that we would tend to see more outbursts of cholera. We don't see a lot of cholera here, but certainly we can see things like cryptosporidosis, Campylobacter, leptospirosis. These are all diseases that can happen because of bacteria and parasites in the water. There can also be neurological diseases and skin diseases from contact with contaminated water or with harmful algal blooms. Next, moving on to extreme weather and environmental degradation. We're just seeing again, tons of more hurricanes, flooding, and this is what deforestation looks like. And this is the aftermath of those horrific wildfires that plague the West Coast, and obviously drought. And while we're on the topic of drought and extreme flooding, this is what we can yo-yo between in our state of Illinois, right? We have these, heavy downpours that delay spring planting. And then when the farmers are finally able to plant their crops, then what happens? We get a deluge. And this is what the crops look like, which obviously impacts their growth and their production. And then we have these horrific dry spells, right? So you can get crop failure from either one of these or both. And with that, it obviously impacts access to healthy foods, which can lead to, in many countries, malnutrition or poor nutrition or undernutrition. And in other cases, because you don't have access to healthy food, healthy produce, what do? You tend to eat more shelf-stable, unhealthy, calorie dense foods that are not good for you, and that just feeds the whole the whole plague of obesity and the epidemic of obesity. Having said, talked about healthy foods, I mean, it'd be nice to see, I'm just going on a little tangent here, these crops that we're looking at are corn, and obviously, in our state, it's corn and soybean, 2 monocrops, and it would be nice to see some of this farmland dedicated to growing actual food produce for people, and not necessarily for animal feed. But that's a total aside. Continuing along with extreme weather and environmental degradation, obviously with with huge events like storms, with hurricanes, and with wildfires, it can lead to injuries and fatalities. And if you have destroyed infrastructure, that there is that whole impact of destroying infrastructure. What if your healthcare facility is destroyed or disabled, or the roads are flooded and you can't, or the roads are burnt out and you can't get to your healthcare facility? There's obvious loss of life, property, and livelihood. We've seen endless footage of people just standing in front of the rubble of their homes, and imagine the trauma and the stress that those people are undergoing, if they've not been hopefully not been injured during the process. And so there's a clear mental health impacts, and I could spend a whole lot of time just talking specifically about the mental health impacts, but we are seeing more and more of it as we see more and more destruction and from these severe weather events. Certainly there is the depression, the anxiety, and this is not just in the short term, but in the long term. And there's also an interesting phenomena that people are beginning to recognize in our younger generation, and it's called eco-anxiety. And it's depressing to think that young people who should be excited about life and the future are actually very anxious about the future, because they look at the state of the planet, and they're just terrified at what they're seeing and what their future looks like. Many are thinking that they're going to delay childbearing and may not even want to bring a child into this world because of this. So it's a real thing, and people are really looking into this eco-anxiety. And with all of this extreme weather and environmental degradation that is happening, it is actually an underlying cause for a lot of civil conflict. I mean, we think that a lot of wars are started because people are fighting over land or something else, but if you get to the root of it, many times it's driven by failing crops because of prolonged drought, or because of persistent flooding, and people can no longer grow their foods. And so it's a cause for strife and war. And with this, people have to move. If you can't grow food and eat where you are, you got to move. And so people are on the move, and there are all of these refugee camps all over the world where people are either migrating internally or migrating externally. So we are in this unprecedented refugee status, and many are ultimately climate refugees that we've not seen since World War II, actually, in terms of numbers. And this is not necessarily climate change, but obviously habitat destruction and our encroachment and destruction of our ecosystems, which we are doing a phenomenal job at, is fueling the change in the climate. But and we're seeing massive collapse of every species on the planet, which does not bode well for us. And the more we encroach into our natural world and fragment it and destroy it, this is a result of it. We are going to become more and more in contact with these viruses, with these organisms that were dormant, or there was a check and balance for that. No, we've just removed completely. So this is, like I said, nobody is linking the coronavirus directly to climate change, but this is all part of the canary in the coal mine warning to us. And there are other pandemics to come. So we must learn lessons from this year of 2020 that we've all endured. So as I said, 2020, right? The year where, what a choice we had. What do we do? Pandemic, heat wave, flash floods, right? That's our getaway choices. It's not a great year for the globe, was it? And I just want to touch on this one issue, which is climate equity. So when we think about who is at highest risk of the impacts of climate change, well, it's people at the extremes of age. We talked about the elderly and the very young. Communities of color. It's a BIPOC population, the Black, the Indigenous, people of color populations, people with disabilities, people of low income and minority populations, and people with existing chronic diseases, which tend to be mostly communities of color. And when we think about it, these are the communities that are also impacted by racial injustice, these are the communities that were impacted more heavily by the pandemic. And we could go on and on. And so what we see here is that climate change is this threat multiplier that just layers one injustice and one inequity, one on top of the other. So it's a quadruple whammy for these particular populations. But enough of the doom and gloom. I would like to shift gears and say that we must not panic, and that there is some good news to talk about now. And I'm sure everybody has seen this picture, where this is New Delhi, a typical day in New Delhi pre-pandemic, and this was New Delhi during the lockdown, when they didn't have when the factories were shut down and we didn't have a gazillion cars on the road, that they could actually see blue skies. So as a wise man, Winston Churchill, once said, never let a good crisis go to waste. So while there's a lot of threats, there's also a lot of opportunities. And as I see it, climate solutions are health solutions. And I'm just going to touch on a few. So one of the things that I think that could make a big difference is promoting sustainable diets. So for instance, if we look at the consumption of meat, that accounts for about 57% of the carbon footprint of greenhouse gases emitted in the average diet. And when we look at the health impact, energy, like eating a lot of red meat, contributes to approximately 11 million premature deaths per year. So if we could transition or promote or have people engage in a more sustainable diet, a more plant-based diet, it's a win-win-win situation. It's good for our heart and it's good for the planet. There's a movement called Meatless Mondays that what they're saying is just one day a week, if we were to not eat meat, particularly red meat, beef, that the amount of we can see the impact that we could make in terms of reducing greenhouse gas emissions. And there are a lot of estimates. If you go to their website, meatlessmondays.com, they have all sorts of fun data on how much carbon dioxide you would save by not eating meat for that one day, just one day. So it's not a huge sacrifice. Nobody's telling anybody to become a vegan, but this is something that I think is very doable, and we really should be trying to promote.
Yeah, so as we are trying to promote and figure out what we're doing community-wide for Earth Day, that was one of the suggestions that we came up with, was trying to encourage people locally to try out a Meatless Monday. And I agree with you, Japhia, that is a really nice, simple approach to making it seem more feasible for people who might not be used to that. I love that graphic, and I think we need to share that graphic more. I'm gonna go check out that website.
It is a fun website, actually. They have fun little infographics. A biggie, switching to clean renewable energy sources, which is where really a big push should be. This study done in 2017 said that, we would save 52,000 American lives just by transitioning to solar panels. And I thought this was pretty interesting. This is the mortality from coal-fired power plants in the US. And you can see that, these really dark areas are not good, right? This is the parts per million pollution from coal-fired plants. And there's a huge, there's a huge movement now with the Clean Jobs Energy Act and with the Biden administration. So this is something that we should all be getting behind and pushing for. Talking about health solutions, creating more walkable, bikeable, transit-supported cities where we're not all jumping into cars to drive 50 feet down the road. Because physical inactivity contributes to about 5 million premature deaths per year. So, if we created or built environments to be more pedestrian friendly and to where we're walking and engaging with each other more than just jumping into cars, then I think that would be a win-win-win again. And so I like this little infographic. Individual climate action is important. But so is collective action. And all this is Swiss cheese model is saying that, each of these has holes in them where they're not perfect solutions, but you layer them and then you have a much more wholesome solution. And at this point where we are with the climate crisis and with the biodiversity crisis and pollution crisis and the pandemic, I really do think that collective action is what we need. And obviously with individual action, but collective action is what is needed to change, to right this boat. I'm going to end with so this is drawdown. These are some solution. This book has some amazing solutions to reversing global warming. I highly recommend this for everybody to read. And because I'm a master gardener and because I've always been passionate about environmental conservation, I'm just going to touch on the nature-based solutions just for 5 seconds before we close. But all of these are important. I would say that this energy transition is probably going to be the most important thing that's going to help get us out of this hole that we're in. Nature-based solutions, what are they? So they're solutions so they basically work on the premise of protecting intact ecosystems. Here in the Midwest, we don't really have a lot of intact native virgin prairie, but certainly we can work to restore native prairie ecosystems from degraded to something close to its original glory. And also sustainably managing working lands. So we're a big agricultural state, and that's a whole nother talk about our food systems and what's wrong with the way we are growing our food. But I would love to see a paradigm shift to regenerative agriculture, where we're partnering with nature, where we're protecting our soil and diversity and approaching the growing of our food in a much more holistic way. Again, with nature-based solutions, by the way, I don't know if you know this, but the decade that just ended from 2010 to 2020 was the decade of biodiversity by the United Nations. Hopefully we're making some strides, and I do think we are. There's all sorts of movements to rewild, to reforest, to regenerate. Scotland plans to turn 30% of its land back to nature. Africa, this is one of the biggest reforestation programs in the world. They want to build this great green wall of Africa. So, let's hope that these things really happen. We're trying to save the monarchs. I mean, right here in Champaign, this is us trying to create more pollinator habitat through the extension office, and there's a global network that's doing that. They're working to get rid of that horrific plastic garbage patch in the Pacific. So lots of good things are happening. So really, it's not all doom and gloom. And like I said, I'm passionate about nature-based solutions because I think that they're so interrelated to our health solutions, or the health of humans and the health of the planet are inextricably linked. We depend on the planet and its ecosystems for everything, for our health, our safety, and our prosperity. And that is why I'm so passionate about protecting it and promoting ways that we can be healthier and keep our planet healthy. And I end with these are my four-legged children, Mitzi and Lucy, who are part of my web of life and my family's web of life. So I went way longer than I thought I would, but
that's okay, Japhia. For all of you joining us tonight, it was absolutely excellent information, Japhia. I know you had aimed to, spend about half that time on your talk, but I think what's evident is just your passion for all of this. And no, that's okay. It's been great. So just a little bit of housekeeping for a moment. I'm going to stop recording.